Okay, hi everyone. I am Munawar Safiri and hello in my this video. Today inshallah I will talk about the common infectious disease. Okay, in this video I will talk about the two most common infectious disease is gastroenteritis and influenza. Let's start to begin in gastroenteritis. Okay, what is the gastroenteritis? It's inflammation in the lining layer of the stomach and intestine. It's usually caused by a bacterial or viral infection, and it's affected of all ages of people, but is particularly common in younger children. Most cases in children are caused by a virus called rotavirus. Okay, now we will talk about signs and symptoms about gastroenteritis. Watery diarrhea, nausea, vomiting, fever, and abdominal pain. Okay, this disease may be developed and cause complication. Like the main complication of gastroenteritis is dehydration. It occurs when the body eliminates too large quantity of water and mineral salts, which are essential to the proper function of the body. Assess the child for the sign of dehydration like sunken eyes, weakness, decreased urine output, and decreased elasticity. Okay, how can I manage this disease? Treatment dependent on these signs and symptoms. Increase the fluid intake. Give the child appropriate antibiotics if the cause is bacterial. If the child have fever, remove the clothes, open the window or air conditioning tree, put cold compresses in the neck, forehead, groin or axillary. Okay, how can I prevent this disease? Get your child vaccinated. Wash your hands regularly. Keep a distance between the neighbors. Defecating to the hard surfaces and cook the food very well. Okay, now we will talk about the influenza disease. What is influenza? Influenza is an viral infection of the nose, throat, and lung, which are part of the respiratory system. How it's transferred? As we know, influenza is communicable disease, meaning it can transfer between people, and influenza virus travels through the air in droplet. When someone with the infection cough, sneezes, or talks, you can inhale the droplets directly, or you can pick up the germs from an object, such as a telephone or computer keyboard, and then transfer them to your eyes, nose, or mouth. Okay, what the signs and symptoms happen in the influenza? At first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat. Cold usually develops slowly, but the flu tends to come on suddenly. Okay, the common signs and symptoms happen in influenza. It's fever, mean your body temperature more than 39 Celsius, chill and sweats, itching muscles, headache, and cough may be productive or dry. Runny nose, sore throat, eye pains, and vomiting or diarrhea. Okay, how can I management the influenza? Usually, you will need nothing more than rest and plenty of fluid to treat the flu. But if you have a severe infection or are at higher risk of complication, your healthcare provider may be prescribe an antiviral medication to treat the flu. Okay, we don't need more than supportive care. First, choose water, juice, and warm soups to prevent dehydration. 2. Rest, get more sleep to help your immune system fight infection. You may need to change your activity level depending on your symptoms. Consider pain reliefs. Use acetaminophen, as we know it's a camol or paracetamol or ibuprofen. Okay, may have some complication in this disease. In children and adults at high risk may develop complications that may include pneumonia, bronchitis, asthma, heart problem, ear infection, and acute respiratory distress syndrome. Okay, finally I will talk about how can I prevention the influenza. The first and the most important step in preventing the flu is to get a flu vaccine each year. Flu vaccines have been shown to reduce flu related illness and the risk of serious flu complication that can result in or even death. Okay, thank you for listening.